So cause of death for adults in the mid-range estimate, the most common cause of death is cancer, this big group here. But you'll see that over half of this estimate is non-cancer deaths, 57%. And in that, there's circulatory disease, respiratory disease, I can't read it on my thing, so I have to, endocrine, nutritional, metabolic disease. So there's quite a range. Because we didn't have specific disease criteria, it actually covers almost all of the possible disease codes that are out there that are in use. But mostly, it's the most common diseases: cancer, circulatory, respiratory, metabolic, nervous system. The nervous system disorders includes a lot of the neurological things like Alzheimer's, motor neuron disease, things like that. For the children and young persons group, you can see that, just like I said before, these two groups here, that's conditions originating in the perinatal period and congenital malformations, deformations and chromosomal abnormalities, and they're predominantly all under 1-year-old deaths, those ones. In the report, you'll see there's a slightly different pie chart with those deaths removed, in which case cancer becomes the leading cause of death, followed by, I think it's external causes. So the interesting thing about that is it raises some issues around providing palliative care for that big group, the under 1-year-olds, and how is that done and who provides it and should it be provided. I know that the Starship team do provide care, and it's predominantly care for the parents rather than for the neonate. So also looked at where people die in New Zealand. The blue bar is all deaths in New Zealand taken over 3 years, and the criteria that we use to allocate a place of death, because there's not a place of death in the mortality collection database, so we had to allocate one based on information that was there, like their facility code, the address, the name of the place. So it may not be 100% accurate, but I did do a quick check of facility codes, and they aligned quite close, or they did all align with the place of death being a hospital or a rest home. So the blue bar, that algorithm we used for our estimates was applied to the all deaths, and so that's in New Zealand all deaths population view of where people die. So just over 30% die in hospital. It's about 33, I think, 31% in residential care, 22% in a private residence, about 6% in hospice, and I think it's about 7% in other. But comparing that to the mid-range estimate, this yellowy one is adults. So based on our mid-range estimate criteria, most of those people died in a hospital, about 47%. Lesser people died in residential care, and again, fewer in private residence. Slightly more in hospice, and that might be because there's a lot of cancer deaths in our estimate compared to all deaths in the country. For children, it's again very different, and most deaths in the CYP group were in hospital, and again, that's predominantly because a lot of those were in under 1-year-olds and perinatal deaths. I did a fairly brief analysis of what sort of things influence where people die based on the data that we had. So depending on your age, your age has an influence on where people die. For example, people over age 80 are more likely to die in aged residential care than other people, which is probably not surprising. Your people's ethnic group had an influence on where they died as well. And this is just an example again. If you're Māori, you're more likely to die in a private residence or a hospital. European, more likely than the other groups to die in a hospice. Pacific, also more likely to die in private residence or hospital. And I think off the top of my head, Asian, more likely to die in hospital. Deprivation also had an influence on where people died. Most deprived groups were more likely to die in hospital. At least deprived groups were statistically more likely to die in a hospice compared to the other groups. Not that that was where they tended to die more often, just compared to the other groups, they were more likely to die there. And also the underlying cause of death, so people who had cancer as an underlying cause of death, more likely to die in a hospice or in private residence. Some of the other ones like cardiac was more likely to die in a hospital. I think respiratory was the same. So that's just a very brief overview. Please, we only got a limited number of these printed, so if you didn't get a copy in the post, which most of you probably didn't because we only had 100 to send out, go to our website and download it. It's only 66 pages long, so it's not a huge document if you need to print it out. If you print it out in colour, it'll be good because it's got lots of nice coloured charts in it. But yeah, have a read of it. There's a lot more information there about how we did the needs assessment and the things that we found. But that's only the first part. The next stage is to take this information and look at what that means for what core services we should have in New Zealand to meet the need identified in this part. And then, so for example, look at how many palliative care beds we should have, what our workforce should be like, perhaps where the workforce should be and how it should be made up. And then compare that to currently available services. So any of the CEOs here will know that they've been getting emails from me saying, can you tell me how many staff you've got, how many beds you've got, how many patients you've got, that kind of stuff, so we can work up a map of what we've currently got at the moment. Compare those two, see where needs are being met and where there are gaps, and then take all of this information, and probably what we're going to do is do a bit of a road trip around the country, get palliative care providers, planning and funding, DHBs together and say this is what we found and these are the gaps, if we find any, we probably will, I imagine, and to say, well, what should we do about it? So the council doesn't want to say, this is what we found, this is what you guys all need to do about it. We want to say, this is what we found, what can we do to address these gaps, what should recommendations we put to the Minister, and what should be our priorities for action. So our expert advisory group is continuing to provide advice. We have a meeting in August to look at where I'm up to with phase 2 and agree on some of the methodology we're going to use. I still do need some more data, and the stuff that I need now is getting a bit more tricky to get a hold of. It's things like, where are the palliative care beds outside of hospices? It's quite hard to find that out, but there are beds out there, particularly in rural hospitals and in residential care facilities. Probably I'll need some more data on workforce to look at to do the analysis and to do modelling for future. But probably we'll use a similar methodology to what Health Workforce New Zealand did, but we'll be using current workforce information and the estimates from phase 1 of the needs assessment to develop what we should have and what we're going to need into the future. And we also need to have a go at trying to get a handle on palliative care provider outside of specialist services. And that's not an easy task because there's no way really to measure how many people get generalist palliative care. So we're looking at some proxies for that. So things like how many GP practices have accreditation through the Cornerstone palliative care component of the College of GPs. How many residential care facilities say they provide palliative care and how many have contracts to provide palliative care. How many people in residential care have received palliative care training through Hospice New Zealand. So things like that, because we don't have a good way of measuring the number of people who get palliative care and how many people are providing it, so we're going to try and see what we can do with that. But it's not easy. So we're aiming to hopefully have phase 2 done by the end of the year, and that should include coming out to talk to people about what we found and discuss the way ahead with that. And I think that's it from me. If you want to get the report, our website is there, palliativecarecouncil.govt.nz, or it's on the cards or leaflets at the back of the room as well. So thank you very much, and that's it.